Welcome back to Senior Care Today, Life Programs of Southwestern Pennsylvania. CEO of Life Pittsburgh, Joanne Gago, joins us now to talk about community health choices. And that's a wonderful, wonderful way to start. Joanne, welcome to the show. Thank you so much. We appreciate you being here. What is a community health choice? It sounds very official, and it's something we need to know about.
Yes. Well, Pennsylvania, like many other states in the country, is now moving toward this program called Community Health Choices. It really takes care, this is kind of an insurance plan for people that have been on medical assistance, and it provides a coordination of care for them. Right now, if you talk to anyone who's on a Medicaid program or a medical assistance program, you'll find a very fragmented approach to their care. Community Health Choices should create a certain coordination and a certain organization to their care so that there's not any confusion about the goals of their health care.
And I'm sure it is a confusing process, and especially as we age and there's so much that goes into it. Well, how does the LIFE program then fit into all of this?
Well, somewhere in 2018, we will be embarking on this program through the state that will ask for managed care organizations and the LIFE program that will sit right beside those managed care organizations to take assignment of all the people that are currently on medical assistance, and many of which also receive Medicare. We call those people dual eligibles. They have both Medicare and Medicaid, and those are the folks that have kind of dropped through the cracks. The idea will be that the LIFE program sits beside these managed care organizations as an equal partner to that, and will allow us to care for as many older adults that need us. So we fit right into the plan. We've been here for 20 years in the community. Many people don't know about the LIFE programs in southwestern Pennsylvania.
I'm sure they don't, and again, it's something that the more and more that I've even heard about it today. I mean, this is a phenomenal program for everyone.
Well, for all three groups, for the persons that receive the services, they love it because they can choose. There's a lot of freedom in the program. They get many services that they would not get under traditional services, under traditional insurance. Generally, the insurance providers love it because we take kind of a complicated participant, complicated patient, and we manage their care for them. And then thirdly, frankly, almost all the providers that work in the LIFE program feel so enthused because they don't have to follow some algorithmic or some plan or pattern of care. They can do what the individual person needs, which is really refreshing.
I always wonder about why people don't know about these programs. Where does that issue lie? I mean, who's not letting them know, or how are they not finding out? Or somebody saying, hey, have you ever heard about the LIFE programs? You know, why?
I think that's a great question. We've been here for 20 years, and it is sort of a little known secret. Part of it is it takes a lot of dollars to, if you will, publicize and market and advertise, and that's not what we really do. We're here to care for people, and the message needs to get out a little better, and that's kind of why we're really happy we can participate in this showcase.
What about eligibility requirements? I'm sure that's a question that many people have. Well, how do I know if I can even take advantage of these benefits in this particular program? You
might say to yourself, this doesn't sound like an elder care program when I say it's age 55 and older, until whatever age one gets to. And it generally is serving people who are lower income, who would right now qualify for medical assistance. It also can also take care of people that are not on medical assistance if they're interested in doing a private pay for that. So in terms of the additional eligibility requirements, people need to be at a level of care where they actually need the services of a nursing facility, but don't want to live in a nursing facility. So they have pretty significant needs. They're usually fairly ill, somewhat disabled as a part of their aging process for them, and live in a certain catchment area. Southwestern Pennsylvania is fully covered in that way.
What would you say? Obviously, you were talking a little bit about getting the word out. That's a challenge. What would be maybe the other big challenge that you face?
I think most people are not aware of the fact that managed care is coming. So many of our older adults in southwestern Pennsylvania are going to lose the control of their health care if they don't get into a program that will allow them to have a lot of freedom and a lot of choice. So for me, it is so important, after doing this for almost 20 years, to have people know that there's a program there that would be interested in their individual needs, not a blanketed way we pay for something or another, or you can only qualify this test or that way. No, this is an individually approached program that's always in the individual context of the person, which makes it so different than every other insurance plan, because it works by some sort of map, and that's what dictates the company to pay for things. So that's just not how it is here. And people have no out-of-pocket expenses for this. That's really important to know. There are no co-payments or deductibles. This is paid for if you qualify. And again, it's for the medical assistance piece that allows a person to qualify.
All right. Joanne, thank you so much for sharing with us today and for joining us here in the studio. We're going to be right back with some final thoughts about senior care. That's next when Senior Care Today Life Programs of Southwestern Pennsylvania continues.